Hey, you're welcome to the Live It Up podcast, a podcast on life, lessons, and survivorship with non-communicable diseases such as cancer, heart disease, and so many more. My name is Brandy Valentine, and I will be joined today by Dr. Noleb Mugisha, who will be breaking down to us what cancer is, treatment, and care. I'd like to remind us that this podcast is proudly brought to us by the Uganda Cancer Foundation, the Uganda Cancer Institute, and the Tribe UG. Please feel free to keep in touch or sponsor or donate to support children battling childhood cancers through our website that will be written right down here. Today our topic is broad and very important to society, and that's why we have a senior over here who will be breaking it down to us. You're welcome, Dr. Noleb.
Thank you, Brandy.
Please introduce yourself.
I'm Dr. Noleb Mugisha.
Yes.
I work with Uganda Cancer Institute, and I lead the cancer prevention services.
Yeah.
And specifically, I lead our comprehensive community cancer program.
Yes.
And under this program, we have 3C,
Yes.
children caring about cancer,
Yes, please.
through which we are trying to empower young people, and especially those in schools,
Yes.
to learn how to contribute towards the cancer fight from where they are.
Yeah.
And it's also important for everyone to know that I'm a father of
Yes.
one boy
Oh.
who is now about to make 6 years,
Good for you.
and married to one wife
What?
who is a woman.
Which is very important.
Yes,
Yeah.
but I am passionate about fighting about cancer, and specifically preventing cancer, because many cancers can be prevented. As a
Yeah.
matter of fact,
Yeah.
60% of the cancers that we treat here in this country can actually be prevented.
Yeah.
And the rest can actually be diagnosed early, so that we don't have, the many deaths due to cancer that we do have.
Yeah, that's
So-
that's fortunate enough, and we're going to break it down one by one, and we shall start from the top. What is cancer?
Excellent, Brandy. This is one of the questions that even within our medical fraternity, many people, keep asking themselves. But cancer is a group of diseases. One, it's usually an error for people to think cancer is one disease, but cancer is a group of diseases. The way you say heart disease.
Yeah.
Heart disease is not one disease.
Yeah.
It can be vulvar heart disease, but cancer is a group of diseases that develops when body cells begin growing abnormally, and these cells, when they grow by producing other cells, which are cancer cells. And so what usually results is either a swelling, which we call a tumor in medical English,
Yes.
or an abnormal number of these abnormal cells.
Yeah.
The cells are abnormal, but also the number is abnormal,
Yeah.
as happens in leukemia.
Yes.
Leukemia is a type of cancer that is blood cancer that begins in the bone marrow. But I want to make it simple for our viewers and our listeners that cancer is a group of diseases. That's one.
Yeah.
Number two, cancer develops when a cell becomes abnormal and grows in an abnormal way.
Yeah.
So, but also an important fact to note about cancer is that actually cancer can spread
Yeah.
from where it starts to other parts of the body. So it can spread by producing more cells, and the swelling becoming bigger,
Yes.
or the abnormal number of cells in the bloodstream becoming more,
Yes.
But it can also spread by these cells moving in the bloodstream,
Yes.
or in the lymphatic stream, and going to other parts of the body. So you have a cancer that begins, let's say for instance, in the breast,
Yeah.
and these cells break off and move in the bloodstream and can go and settle in the lungs and begin producing cells like themselves.
If
So you have...
Yeah. If
Yes.
unchecked, and it's even after treatment, does it?
No,
does
we'll
it
come to the treatment.
Okay.
I'm giving the
yes.
natural definition of
Okay,
cancer,
Okay.
when there is no treatment. Because when patients come to us, some of them come when the cancer is no longer limited to where it started,
Yeah.
but it has spread to other parts of
Other
the body.
parts of the
So you have
body.
somebody come with breast cancer,
Yes.
they have a breast swelling,
Yes.
but they also have a swelling in the liver.
Yeah.
And probably what has brought them is because of this swelling in the liver causing, the yellowing of their eyes. And so they said, doctor, what is causing my patient to have their eyes yellow? And then we say, it's breast cancer. They say, how come?
Yeah.
The swelling is in the liver.
Yeah.
So I'm trying to explain that, because if you explain the abnormality of the cell without explaining the fact that cancer can spread, then the definition is not very clear to some people who have interfaced cancer in its state when it has spread.
Oh, yeah.
And this cancer that has spread to other parts of the body, we actually say it's a cancer that has metastasized.
Okay.
Am I timing you?
I'm checking my spelling.
Yes. So important that people know that cancer begins with one cell, and cancer begins in the body. It doesn't come from outside. Yeah. Because some people say cancer is a virus, cancer is bacteria, cancer, as if, it's a germ. Cancer is not a germ. Yes.
Which brings us to our next question. You said it starts from inside, but under what circumstances is one likely to get cancer?
That's a very good one, because people want to avoid these circumstances.
Amazingly true.
People want to, So, one, many cancers do not have a specific cause.
Yeah.
And I usually say this slowly so that people can appreciate, They do not have a specific cause, but there are a number of factors that we call risk factors.
Yes.
That put an individual at risk of suffering from cancer.
Yes.
Yeah. So because you asked the question, under what circumstances?
Yes.
So I want to say it's under all circumstances somebody can develop cancer. So there's no one who should say, in my circumstance, I can't suffer from cancer. No.
Yes.
There's no circumstance that puts somebody, in such an advantageous position that they cannot suffer from cancer. So, but there are circumstances that need to be in place, or there are factors that need to be in place to make an individual develop cancer. And these are the ones that actually are important for people to know so they can avoid them. Or if they can't avoid them, they can continue checking themselves to see, if they have developed cancer. Because cancer is one of those diseases you cannot say there's a magic bullet to stop somebody from suffering from cancer.
That's true.
And it's important that all of us know that we are all at risk.
Yes.
And so none of us is immune. None of us is exempted.
Yeah.
You can't say I'm a doctor, so I can't suffer from cancer. No.
Or I exercise every day, I can't suffer from cancer.
But these are the circumstances these are the risk factors for cancer. Number one, in general.
Yeah.
Number one, one risk factor is growing old.
Oh, that's so sad.
As we grow older, our danger of developing cancer increases.
Yes.
Bottom line,
yeah.
And I said in general. Another risk factor for developing cancer is having certain infections.
Yes.
Or having some infections. One infection is human papilloma virus.
HPV.
Yes. Against which we are vaccinating girls who are 10 years of age to prevent them from suffering from cancer in case they get infected when they are older.
That's true.
When we say we are vaccinating 10-year-old girls, people are like, do 10-year-old girls suffer from cancer of the cervix? The answer is no. But all those who suffer from cancer of the cervix were once 10 years.
They were once 10 years
and
old.
This vaccine is given at 10 years because these girls have not got the infection, majority of them.
Yes.
And the infection is better prevented, if we vaccinate these individuals before they catch the infection.
Yes.
So there are other infections. HIV is one of the infections that actually increases one's risk of suffering from many cancers.
Yes.
Yes. And I won't mention the cancers.
Yes.
There's another time for that.
Yes.
The infection with hepatitis, viral infections, hepatitis B, hepatitis C. Yes. These infections increase the risk of suffering from liver cancer.
Oh, yeah.
So I have talked about growing old or aging.
Yes.
I've talked about infections and I have highlighted HPV, hepatitis B and C. I've highlighted HIV. Now, there are other infections that are not very common, but infection with Helicobacter pylori. It's an infection that causes peptic ulcers or gastric ulcers, or what commonly people say ulcers,
Yes.
So when somebody gets infection with this, they are likely to develop cancer of the stomach.
That's true.
Now, there's another infection called Epstein-Barr virus that is a risk factor for lymphomas, and commonly here we see Burkitt's lymphoma. So, in short, infections.
Yes.
Now, number 3, using tobacco.
Yes.
Smoking, chewing, sniffing tobacco can increase the risk for lung cancer and many other cancers. There are over 10 cancers that are associated with tobacco use.
Yes.
Number 4, sedentary lifestyle. Now, we are talking about doing exercise, and many Ugandans don't like doing exercise these days because of the coronavirus pandemic and the associated benefits. I see many people jogging on the roadside. But all of us need to do exercise, whether we are small-bodied like me or we are fairly,
like me. My father worked in the government for some time.
Yes. So we all need to do exercise because physical activity does not only reduce the risk for cancer, but many other NCDs.
That's true.
Many other non-communicable diseases. Talk about diabetes, talk about heart disease, talk about, many other non-communicable diseases. So sedentary lifestyle or not being involved in physical activity increases the risk for cancer.
And also physical activity is good. It makes you sleep better, you feel better, you look better, it's so much, but it's good. You should try it out.
Better
you perform
in class.
Better. Okay, I'm not in class anymore, but you perform better even at the job, even in whatever you choose to do. That's true.
No, but also it makes you feel better.
That's true.
Yeah, the times I jog in the morning, I feel better the entire day.
Yeah.
So it's not only for cancer. And then also another risk factor for cancer actually is early sexual activity. Now, I want to mention this, but also add onto it. When girls get involved in sexual activity, one of the researchers actually I was part of, we found out that when girls get involved in sexual activity before they are 17 years, their risk for developing cancer of the cervix is 3 times higher than those who start after the age of 17. Now, there's nothing magic about the age of 17. That's just the age, that we observed in our study. But what I'm saying is that it's important that we delay our sexual activity, and even when we start, we should not have multiple sexual partners.
One person at a time.
One person all the time.
One person all the time.
Okay. Now, it's important that we have one sexual partner.
Yes.
It's important to say at a time because some people divorce and remarry.
And also some people date people who are not really... Okay, let's
we can keep that at this point. But it's important to make sure that we have responsible sexual choices. And I say it slowly so that we can understand what it means. That before you choose to have this person as your sexual partner, you should know particular things about them. Is she going to be my wife? Do I know who their partner was? Because research has shown that people who get involved in sexual activity with partners whose former partners had, for instance, cervical cancer. It could be a man whose former sexual partner had cancer of the cervix. The risk of this new sexual partner developing cancer of the cervix is higher because HPV is in the whole...
It's in the whole sexual network, basically.
Yes, you have it right. The sexual network. Now, I don't want us to be diverted. We're talking about the risk factors for developing cancer. And I will enumerate them again before we close. Now, another risk factor for developing cancer is multiple sexually transmitted diseases. So there are people today, they are diagnosed with syphilis, tomorrow gonorrhea, the next day another STD. Those ones are at a high risk of suffering from cancer of of the cervix, or cancer of the penis.
Yeah.
Now, there are other risk factors for cancer. Some are genetic.
Yes.
There are some leukemias whose risk factor is really genetic. Somebody inherits a genetic mutation that puts them at risk of suffering from cancer. So I talked about risk factors that we can't do anything about. You can't change your genetics, Brandy.
Yeah.
If you're light-skinned,
That's
there
it.
you are. You can try to darken your skin.
Yeah.
But the day you have no money to darken your skin, we will see
like
that
the
you're...
sun.
Yes. And then there are also risk factors that are associated with what we do. Exposure to smoke.
Yeah.
Whether it's second-hand cigarette smoke.
Yeah.
It could also be exposure to fumes. So we
when
need
you
to
stay next to
protect-
the factory or something like that.
when you're living... No, you may not have to stay next to the factory.
Yeah.
You may be staying in a place like Beijing. My friend who went to Beijing told me at some point in the day, you have to move with a mask.
Yeah.
So that's not a healthy environment.
Yeah.
When you breathe in all these fumes, all these poisons, and they settle in your lungs, they can actually initiate a cancer process.
Yeah. Yes.
So I am talking about those that are really not very common. Now, there is also the diet that we eat.
Yeah.
And I want to stop a little bit so people can reflect on the diet they eat. If you eat diet that is rich in fats,
Yes.
diet that is rich in meats.
Yes.
I want to mention...
red and white or red?
First, listen.
Yes.
All meats.
All meat?
Yes. Now, red meat is probably more risky than white meat.
Yes.
But when you're grown up, like you, Brandy, and me,
Yes.
you don't have a lot of business eating a lot of carbohydrates and proteins.
Yes.
Because any excess calories is the energy we get from food.
Yeah.
Any excess food you eat is stored in form of fat.
Yeah.
And when it's stored in form of fat, it can actually block the small blood vessels.
Yeah.
And therefore, you get parts of your body that are not well supplied with blood.
Yeah.
Because when blood reaches these body parts, it's able to take away the poisons that the cells produce as they go about making us live.
Yes.
So when that is the scenario, then the risk for developing cancer increases.
Yeah.
So I want to enumerate them again.
Yes.
Number 1, tobacco use.
True.
Number 2, infections.
Okay.
And I don't want to enumerate them again.
Yeah.
Number 3, sedentary lifestyle or minimal physical activity.
Yeah.
Number 4, poor diet. Diet that is rich in meats and fats.
Yes.
That's dangerous. We recommend diet that is rich in vegetables and fruits.
Broccoli, cornflower, booger.
Cabbage, sukuma wiki.
I don't even want to continue. You know
mentioned
the
another
list.
one.
Yes.
Yes.
Butterscotch.
Yes. So we also recommend that you do physical activity so that you're not living a sedentary lifestyle. Yes.
Okay. Thank you very much. Now we go to signs and symptoms. If I was walking in a group of people, how am I able to identify that my friend could be showing signs and symptoms? What signs and symptoms should one identify before they choose to seek medical attention?
That's a nice one. Now let me tell you, Brandy.
Yeah.
If you're walking in a group of people, you won't observe that somebody has cancer.
Yeah.
That's how God has done it.
Yeah.
He's able to protect our privacy.
Yeah.
Yeah, but how can one know that they are likely to have cancer? Because it's not a disease that will show on the outside. Like when I get gray hair, you will see.
Yeah.
When I have a bald head, you will see.
Yes.
But when somebody has cancer, you will not see.
Yes.
Unfortunately. And also fortunately. Sometimes it's important to protect, one's privacy. But what are the signs of cancer? Number 1, and these are general signs.
Yeah.
Number 1 is actually loss of weight.
Yeah.
Now, this is not common to all cancers.
Yes.
For some cancers, somebody will keep their weight and they will have cancer. But one common, sign of cancer is loss of weight.
Yeah.
Number 2, abnormal swellings.
Yeah.
So this is probably something you could notice on a friend.
Yeah.
If a friend has a swelling on their back and they are putting on a very nicely fitting top, you could
Yes.
say, I see a bump on your back.
On your back. Yeah.
And then maybe that could be. And there's a friend who noticed that her friend had a bump on her buttocks,
Yeah.
you know?
Yeah.
And says, but I see something that is not usual.
Yeah.
And she was the first one to observe that the friend had a swelling that turned out to be cancer, and unfortunately, she died.
Sorry.
Yeah. So what you said is right, that when we are walking around with friends and we are observant, we shouldn't say, maybe I should keep quiet. No.
Yeah, because you spend a lot of time with these people.
Yeah,
so why
just
not?
say, Brandy, I see something funny on your shoulder. Maybe they haven't seen it before. So abnormal swellings, loss of weight, and also abnormal bleeding.
Yeah.
You know, people with leukemia sometimes just bleed when they brush their teeth.
Yeah.
You know, when something cuts them, they bleed longer than normal. I said abnormal bleeding.
Yeah.
So you're bleeding longer than you should bleed. Every time we bleed,
cut,
you know, our blood should clot.
Yeah.
But when there's leukemia, sometimes the blood doesn't just clot the way it should clot.
Yes.
Yes. Another sign for cancer could be passing stool that has blood in it.
Yeah.
You know, it could be black stools. It could be just flank blood in the stool.
Yeah.
Yeah, that could mean somebody has cancer in their intestines. When it's flank blood, usually it's very close to the anus.
Yeah.
Yeah. When it's black stools, it could mean the cancer is up in the alimentary canal.
Yeah.
Yes. Coughing blood could mean lung cancer.
Yeah.
You know, and some people will cough blood because they have pneumonia, because they have maybe some sore on their throat.
Yeah.
But if anyone is coughing blood, anyone is passing bloody stools, we shouldn't take these for granted. We should make sure they are investigated, and if there is cancer, it's identified. And then difficulty in swallowing. Some people have cancer of the esophagus, what we used to call the food pipe.
The food pipe,
in
yes.
P3.
In P3, P4.
Yeah. If somebody struggles to swallow their food, it could mean something is blocking where the food passes.
Yeah.
That could be a tumor. That could be a swelling on the throat.
Yeah.
Yeah. And then passing urine all the time.
All the time.
If a man is 50 years and above, and in the night they are passing urine 5 times, it could mean their prostate is enlarged, and so they have this recurrent infection in their bladder, and so they keep passing urine. Or difficulty in passing urine.
Yeah.
You know, the man goes to susu. Is susu an English word?
No, it's not.
It's not.
But
A
also
man goes to pass urine,
oh, yes.
and then they have to force it and force it.
Yeah.
It could mean the prostate is enlarged. It's blocking the passage of urine.
That
could
very
be the
painful.
first indicator
Yeah.
that sometimes it's not painful,
Yeah.
but it's painful psychologically when
I
somebody
agree.
goes to pass urine and they have to force it like.
Yeah.
Then, now another thing that people should know: pain.
Pain.
Yeah, pain. Pain in the abdomen, pain in the chest, pain. Now, pain is a late sign for cancer, usually.
Yeah.
If somebody waits for pain, the cancer is going to be advanced.
Yeah.
But pain can be a sign of cancer as well.
Yeah.
Now, I want to mention the commonest cancers and their signs.
Yes.
Because if I don't say that, whoever is viewing us, whoever is listening to us will be cheated.
Yes.
Commonest cancer in Uganda in women is cancer of the cervix.
Yes.
The signs for cancer of the cervix are abnormal bleeding.
Yes.
From the private parts or from the vagina,
Yes.
if I'm to be exact.
Yes.
Yeah, because even the armpit is the private part, isn't it?
Yes.
Yeah, but abnormal bleeding, it could be intermenstrual. Somebody doesn't expect to be bleeding now,
Yeah.
and they see the blood.
Yeah.
Or somebody's cleaning themselves and they see blood.
Yeah.
Somebody, is just walking and they see blood.
Yeah.
That could mean cancer of the cervix.
Yes.
And usually there is no pain.
Yeah.
Now, there can be pain during sexual intercourse,
Yes.
and that could mean there's blood. Or there's blood after sexual intercourse,
Yeah.
which we call postcoital bleeding.
Yes.
And this we call contact bleeding, either while cleaning or during sexual intercourse.
Yes.
And then the late sign is they have a very offensively smelling discharge from their vagina.
Yeah.
That is a sign of late cancer of the cervix, but unfortunately many people come when it's already at that point.
Yeah.
Yes. Now I want to mention, I already mentioned the signs
Yes.
of prostate cancer, the
Yes.
commonest cancer in men. But also the second commonest cancer in Uganda now, which is Kaposi sarcoma, which manifests in the skin commonly, but also can manifest in the lungs. The commonest appearance is dark patches on the skin. They have skin swellings. They are like patches, but raised, and they are dark, painless. But they are associated with that part of the skin hardening. Yeah. It's kind of hard, like wood, actually. That's Kaposi sarcoma. So in short, how can you know you have cancer? Yeah. If you lose weight, you're bleeding anyhow from any part of your body. Yeah. You have an abnormal swelling. Yeah. The swelling many times is painless, but it doesn't go away. Yeah. It doesn't develop pus, because many swellings on the body are going to develop pus. If you have, some people can have swelling on the abdomen. Their tummy is swollen. Yeah. Keeps swelling, and you ask them, are you pregnant? Yeah. And they say no. And they discover they have cancer of the ovary. It's one of the cancers that presents like that. If the swelling is in the abdomen and it's in the child, it can be cancer of the kidney. Yeah. Yes. Okay. Again, symptoms for cancer can be diverse. Yeah. But I usually tell people that if you have anything abnormal, think about cancer as well. Yeah. Because, for instance, in children, cancer will have no specific sign. A child may lose a milestone, they may stop growing, they may lose appetite, they may have a fever, but all these can be due to cancer.
Yeah. So, Dr. Noleb, so many times people have perceived cancer as a death sentence, and that's why they always either delay to come for checkups or even do not go for the checkups, or opt for other options rather than going to the doctor. But now I want you to explain, we'll kindly request you to explain to us how cancer is treated so that people know that it's actually treatable, it's curable. That's the word.
Excellent. Now, I want to say this, that 60% of the cancers that we treat here are curable. Yeah. So what I'm saying is that if we lose 10 people due to cancer, 6 of them, we could have saved them. Yeah. If they came here, to the Uganda Cancer Institute. Regardless of the stage, by the way. Yeah. If they came here, regardless of the stage, we could actually cure them. Yeah. Yeah. But cancer generally is a disease that can be treated. Yes. That's the bottom line. Yeah. And majority of the cancers can be cured. Yeah. Yeah. If anything, all cancers can be cured if discovered early and treated properly. Yeah. I can say that again. There are some cancers that we know are very stubborn, like cancer of the liver. It's a very, very stubborn cancer to treat. But we have patients we've treated here and they are living for 10 years, after treating them, treating their liver cancer. So in short, I'm saying that cancer is a treatable and curable disease. Yeah. People need to come regardless of the stage. Yeah. But people need to keep checking themselves for cancer, presenting themselves for cancer checkup or cancer screening, for cancers that can be screened for.
Like breast cancer.
Like breast cancer, like cancer of the cervix, cancer of the prostate, malignant melanoma, So in short, when we make a diagnosis early, we can actually cure the cancer. Yeah. So how is cancer treated? Cancer is treated depending on the type of cancer and also the stage of the cancer. Yes. So some cancers, we treat them by doing surgery, by operating, by cutting off the swelling, or cutting off the part that has cancer, depending on where the cancer is. Yes. That's one. Number two, cancer can be treated by giving chemotherapy or by giving drugs or medicine. Yes. Yeah. Some of these medicine we give them by injections, through drip, or some of them is by swallowing them, by swallowing these drugs. Now, some drugs also can be injected in the abdomen. Some drugs can be injected in the vessel. Some drugs can be injected in the spinal space, in the intrathecal space. We give a spine, we do what we call, we give an injection on the back. But when a patient comes, then we are able to explain why we treat a certain way and why that is important. Yeah. So I'm saying some cancers can be treated by chemotherapy. Yes. Some cancers are treated using what we call radiotherapy. Yeah. radiotherapy is when we expose the part that has cancer to high energy radiation in order to destroy the cancer cells. Now, some cancers can be treated using hormonal drugs. Either the drugs are going to block the activity of some hormones, or the drugs are going to mimic certain hormones in order to treat the cancer. So in short, cancer is treatable, and there are different ways of treating cancer depending on the stage. So some cancers, we need to combine different methods of treatment in order for the patient to benefit. So for instance, breast cancer, we do surgery, we give chemotherapy, we give radiotherapy, we give hormonal therapy. So what I'm trying to say is a person should come forward and then we will give the treatment.
Okay. Amazing. Thank you. We're about to come to the end of this amazing podcast, but I know that to spread the word about awareness and so much more, we do it under the Comprehensive Community Cancer Program.
Yes.
That you're part of. Tell us more about this in a minute or two.
Excellent.
Yeah.
Now, this is the program that I founded here at Uganda Cancer Institute with my colleagues. And so I'm excited to talk about it. So the Comprehensive Community Cancer Program is the program or the mechanism through which Uganda Cancer Institute takes cancer services to the community. Now, where in the community do we take them? We take them to villages. There are villages that have invited us. And they have congregated. We've educated them, screened them, and given them information about cancer. We take it to schools through the 3C program. That is really...
Children caring about cancer.
Children caring about cancer. That is really a child of Uganda Child Cancer Foundation, which Brandy you are part of.
I am actually coordinator now.
So when we go to schools, we give awareness about cancer. We tell children what they need to do in order to prevent cancer, but also what they need to do as children to support, other children or other people suffering from cancer. And I know the question is, where do we see, this Comprehensive Community Cancer Program go? So through the same program, we reach health workers at lower level health facilities. We train them in cancer screening, cancer early detection, and how to support, people suffering from cancer in their catchment areas. Because every Ugandan has their nearest health unit. They may not be able to come to the Uganda Cancer Institute even when they are suffering from cancer and they are on treatment, but they go to their nearest health unit. So through this program, we reach these health facilities and health workers to empower them to know how to support, people suffering from cancer. Where do we see ourselves? So we are writing the Uganda National Cancer Control Plan. Uganda National Cancer Control Plan. And in this plan, we would want to use the community cancer programs to empower communities to be involved in the fight against cancer. We want to see 3C reach more schools, equip more children. We want to see more health centers from Health Center 3 up to the district hospital, screen for cancer and provide cancer early detection services. We want to see more civil society organizations involved in the fight against cancer, either supporting patients, contributing to increasing awareness. We want to see media houses, supporting cancer programs, providing free airtime for Brandy and Dr. Mugisha to go and talk about cancer, so that people can know how to prevent cancer for themselves, but also to how to fight cancer in the community.
That's really awesome. Finally, we are living in hard times, COVID-19. How have you been holding up? Just to break down, how have you been holding up?
That's a tough one, Brandy. Because unfortunately, when COVID-19 hit, we suspended cancer awareness services. Because we've been providing awareness through community outreaches where people gather. So with COVID-19, we couldn't invite people to gather. So we've tried to reach people through virtual means, through radio talk shows, we've reached people through phone calls. People call and ask questions. But at Uganda Cancer Institute, we have an automated voice response where somebody calls, a toll-free number and hears a message about cancer and can ask their own question. And I am thinking that this is really a stitching time,
Yeah.
at this time for people to listen to this podcast
Yeah.
and be able to hear more about cancer.
Yes.
And we are inviting, different players that can support us in being able to, convey information to communities through virtual means where people do not have to come.
Yeah.
But that doesn't mean that we actually close the cancer screening services and the cancer early detection services.
Yeah.
We've been seeing people here, but we see them one-on-one.
Yeah.
We are not inviting people to come in a group.
Yeah.
But we see people here at Uganda Cancer Institute and we attend to them. We are able to take them through the cancer screening process, the cancer diagnostic process, and we've been able to start people on treatment even during COVID-19.
Yes.
Yes.
So finally, what advice do you give people out there treating and caring for cancer patients, and the society at large?
No, thank you very much. One, I want to advise everyone out there to know cancer can be detected early.
Yeah.
If you seek to learn the signs and symptoms, because when you talk about early detection, you're detecting a cancer that is already ongoing.
Ongoing, yes.
Yeah, even if the cancer is already ongoing, it can be detected early. If it's detected early, it can be treated and cured.
Yeah.
That's one. Number two, it doesn't matter what stage a cancer is, all cancers can be treated regardless of the stage.
Yeah.
I know people who came to us with stage 4, cancer of the cervix, and they are alive up to now, 15 years later.
Yeah.
So, it doesn't matter whether the cancer is late or not. Let those cancer patients come and get the right treatment.
Yeah.
Now, how do you support cancer patients when they are in your homes?
Yeah.
Make sure you encourage them to eat.
Yeah.
Encourage them to be physically active, to exercise within the means of their bodies. When they are sick, they can't run like Cheptegei.
Like Cheptegei.
Yes. But they can do exercise. They can be physically active. Encourage them to eat. Encourage them to adhere to their treatment regardless of the side effects. Sometimes the side effects are overwhelming.
Oh dear.
People lose their hair.
Yeah.
People vomit.
That's true.
But when they come to us, we are able to support them to overcome the side effects, because the moment the cancer treatment is completed and the cure is achieved, everything returns to normal. The hair grows again. The nails which were dark because of the cancer drugs, return to their normal size. Of course, if a breast was cut off, it can't come back. But, they can get artificial breasts so they can dress and look like you, Brandy.
Oh, yeah.
Yeah. Yeah. So I am encouraging support cancer patients.
Yes.
Encourage them to adhere to their treatment and complete it. Encourage them to eat, to be physically active, to live normal lives. If they are not sickly, they can work. These days, working online, a cancer patient can work online.
Yeah.
Continue earning their income, continue feeling normal, feeling part of society.
Yes.
Yes.
And also on top of that, you can also support a child suffering from cancer by donating. It could be a car, it could be a toy car, a toy what, or you could also just make donations to their medications, because some of them are present and they need to be subsidized and so much more. Just visit our website on info@uccf.ug.org. And Dr. Noleb has been very, very vital towards giving us information today that would make our lives better. Thank you very much, Dr. Noleb.
You're welcome, Brandy.
I have a joke for you. Our joke for the day. You're going to answer it.
Yes.
So, are you ready?
Yes, I am ready.
What happens when the rain bows?
When the rain bows?
Yeah.
It doesn't rain.
It doesn't rain. That's true. But also, what happens when the rain bows? A rainbow.
A rainbow. All right.
Yes. So thank you very much.
Thank you very much.
Thank you very much for being part of our podcast. Our task this week is just exercise at least 3 times a week. 2 times long sessions, 1 just for relaxing. And eat more vegetables. And keep in touch with us. We shall be tuned in for the next episode with another doctor discussing childhood cancers. Please stay safe and take care of yourself. We are still the team from UCCF, UCI, and the Tribe UG bringing to you the Live It Up podcast. Thank you very much. Have a great time. Bye.